Wishing you all a very good morning. For those of you who've not listened to my previous two talks on the subject of piles, I would request you to go to my YouTube channel and refer to them. So let me take this knowledge sharing crisp talk on this subject further forwards. I shared with you that people come to us with a presumed diagnosis of piles, but it's upon the qualified professional to evaluate and maybe investigate and reach a final diagnosis. Is it hemorrhoids that they're calling piles, or is it fissure, or is it fistula, or God forbid, is it cancer of the anorectum, which they think they've got piles? So I gave you a brief talk on the whole subject of piles in my first lecture. In my second lecture, I did talk about how do we manage hemorrhoids, and in this present talk, I'll devote to fissure and fistula essentially. You see, fissure is a small wound in the anal opening, and a fistula is a pus discharging opening or a pus discharging swelling which is on the side of the anal canal, on the side of the anal opening. And both are to a great extent avoidable and manageable by way of understanding what is proper genital hygiene. By way of an optimal general hygiene, we can to a great extent prevent both these conditions. You see, I would like to explore a myth that we all carry in particularly our part of the world, that the Westerners use tissue papers only to clean themselves up after the motion. I would not like to contest that what the Westerners do, but this speaks of very poor genital hygiene. In our part of the world, people do use water, but even that is inadequate. You see, that part of the body is as precious as your face, as your hands, as every other part of the body. It requires soap and water. After freshening up, after you passed motion, you must clean that area with liquid soap on your hand and wash it well. And now, yes, you use soap, you use water, but how to clean that little part is that the anal opening, not just the bumps, the anal opening needs to be cleaned. You don't need to, of course, push the finger in, but you need to clean the opening. You know, there are a pair of lips there. They need to be cleaned with soap and water. And after soap and water, you need to use some skin care moisturizer there. The best of moisturizers which I know of is Borolene. In India, everybody knows what is Borolene. So use Borolene. It's a zinc-based ointment, which is one of the best skin care moisturizers. Or you may use coconut oil, or you may use any of the moisturizers. So a soap and water cleaning and a moisturizer can prevent most of these problems. It's the lack of optimal perennial hygiene which results into a fissure or a fistula or an abscess. After a fissure is formed, a wound is formed in the anal opening due to a hard motion having been passed, even if you keep it clean after the wound is formed, the wound will heal. But if you don't clean it, then this wound will become chronic, and more than 3 months, if it lasts, we call it a chronic fissure. And now a chronic fissure requires a minor surgical procedure. Without a minor surgical procedure, you will have to continue to live with that pain during motion for years and years. You will get used to, you will know that I have a lot of pain when I pass motion, but what is required is a very small surgical procedure. We just relax your sphincter and the fissure heals. And what is fistula? A fistula is aftermath of an abscess. So aftermath of poor dental hygiene is an abscess or a furuncle or a boil, call it whatever, and that bursts inside and outside. It's called a fistula. So this is a tract which forms from inside the anal canal to the skin, and it requires again a surgical procedure. Sometimes if you let it stay and delay treating it, then it can form multiple openings, and unfortunately we call it a water can perineum. That means multiple openings. This becomes a complex fistula, and more you delay, the more complex it gets, the bigger gets the surgical procedure after all. But when you come in early, it's again a daycare procedure. We just remove it and send you home. It's painless, and you're fine. So this is all that I wanted to share with you about fissure and fistula. I hope you benefited. Thank you for listening to me. Hare Krishna, Hare Ram, Vaheguru.